Chapter 17, the Endocrine System, Screencast 6, Pancreatic Hormones and Aging. This is the final screencast for Chapter 17, and the last endocrine concept that we're going to address is the pancreas. Now, please note, the pancreas is very different than the other endocrine organs we've addressed up to this point. The pancreas is both exocrine and endocrine, and anatomically, the pancreas is much more of an exocrine gland than it is an endocrine gland. It is one of the more important accessory digestive organs, and we'll talk a lot about this when we do the digestive system. Really, the exocrine function of the pancreas is the production and secretion of digestive enzymes. Now, when we look at the islet cells, you may hear them as the cells of Langerhans. Those are the endocrine cells, and they are alpha cells. They're responsible for the release of glucagon, whereas beta cells are responsible for secreting insulin. Now, when we look at the primary role of the pancreatic hormones, it really is to regulate normal blood glucose. The normal range of blood glucose is anywhere from 70 to 110 milligrams per deciliter. High levels of glucose within the bloodstream can actually do significant damage in many areas of the body. We'll be looking at damage to blood vessels and kidneys in particular. So they do play a role in increasing risk factor for heart disease and also kidney disease and potentially kidney failure. Low levels of glucose will cause lethargy, mental impairment, and if nothing is done about it, actual death. So hypoglycemia is much more dangerous on a short-term basis than is hyperglycemia or high blood glucose. Now, once we consume a meal, the beta cells are going to detect the rise in blood glucose, and their response is to release insulin into the bloodstream. Insulin travels through the bloodstream, and it's going to leave the bloodstream to encounter target cells. Insulin will bind to insulin receptors, and it actually is going to initiate the second messenger systems, which overall result in a lowering in blood glucose. Once blood glucose levels are normalized, the beta cells will no longer be producing insulin. Here we see the regulation action of insulin. So the stimulus will be an increase in blood glucose. The beta cells within the pancreas detect this, and the beta cells will actually release insulin. Insulin will stimulate various targets, and here we basically look at liver. So glucose is leaving the bloodstream into the liver. We'll see fatty acids moving into or increasing the production of lipid and adipose tissue. We'll look at increased uptake of amino acids, which is going to stimulate protein anabolism. And then we're also going to see glucose going into other cells of the body. And the net effect here, once again, is a decrease in blood glucose and other nutrients. Now, please keep in mind, quite often, insulin is referred to as a storage hormone, and we can see that here. We basically see that when blood glucose levels go up, we're actually going to see glucose being disposed into various organs and areas of the body. The issue here is if we're looking at excess caloric consumption, we have limited stores of glycogen, and any excess energy is going to be converted into adipose tissue. So this is the underlying logic for a low carbohydrate diet. But keep in mind, the benefits are more to eating a nutritious diet, high in carbs, because once again, that is what our body will use for energy, and also looking at exercise, because exercise also has an insulin-like effect. Now, diabetes mellitus, this is a condition associated with an inadequate uptake of glucose from the blood. What this does is it results in chronically elevated levels of blood glucose. When we look at the damage that is created by this, we look at diabetes mellitus being the leading cause of retinal blindness, kidney failure, and also non-traumatic amputations in the United States. It also is associated with a significant risk for increasing heart disease and stroke. Now, there are two different types of diabetes. The first that we are actually three different types. The first that we're going to address is type 1 diabetes. This is because there is little to no insulin. This tends to occur in children and younger adults. We seem to think that this is actually now an autoimmune disease in which the islet cells have been damaged. And this is going to be the type of diabetes that actually requires insulin. This could be either through injections or an insulin pump, which is a more common way of treating type 1 diabetes now. Type 2 diabetes, on the other hand, we actually see a decreased insulin or the effectiveness of insulin. You may hear this described as insulin resistance. So now the insulin just isn't doing the job that it's required to. Now, probably one of the major causes of the development of type 2 diabetes is obesity. It tends to occur in older individuals, but it can occur in young adults due to the increase in obesity that we are seeing. The general treatment for type 2 diabetes is diet and exercise and various medications. The drug Ozempic, which is almost more commonly used as a weight loss drug, was actually developed and designed for the treatment of type 2 diabetes. That is actually when insurance companies will pay for Ozempic when it's prescribed for the type 2 diabetic. Now, there also seems to be a much stronger genetic component associated with type 2 than there is with type 1. We also have a third type of diabetes, which is known as gestational diabetes. Some women during their pregnancy will develop diabetes. The issue here is if it is not treated, it can actually increase the risk to the fetus and result in complications during delivery. The other thing here is gestational diabetes will actually resolve and go into remission per se after the pregnancy. But what we do see now is that these women that develop gestational diabetes show a greater risk of developing type 2 diabetes later on in life. Now, hypoglycemia, this is the opposite. We're going to see glucose levels fall below 60 milligrams of deciliters. And the thing to remember here is glucose is required because it is the only energy nutrient that the central nervous system can use. There are lots of causes of hypoglycemia. One could be an insulin overdose, and so this is something with the beginning of treatment of type 1 diabetes, not being familiar with diet, looking at insulin injections, exercise, all of those things. So an overdose of insulin, prolonged exercise, the use of alcohol, but also if there are liver or kidney problems. It could be due to a deficiency of glucocorticoids or growth hormones or genetic in nature. The symptoms here are going to be hunger, dizziness, confusion, sweating, and sleepiness. In this situation, this is much more dangerous than hyperglycemia on the short term, and generally someone needs to be given glucagon if that person is unconscious, or given something as far as corn syrup, something along those lines, to result in an increase in blood glucose. Now here, when we look at the regulation and action of glucagon, the stimulus here will be a decrease in blood glucose levels. The alpha cells will detect this, and the alpha cells are going to release glucagon. Glucagon will stimulate various target effectors. Here we look at the liver and adipose tissue, and notice what's happening here. We're going to see the breakdown of glycogen, increasing glucose availability. Also, we're going to see a stimulus in gluconeogenesis, making new glucose present. Also, the impact on adipose tissue is to release glycerol and fatty acids into the blood, and the net effect here is to bring blood glucose back to normal levels. Now, the remaining slides are addressing some other factors related to the endocrine system. We have the pineal gland. This is a small, unpaired body in the epithalamus of the diencephalon. And what the pineal gland does, it actually secretes melatonin at night. And melatonin, some of you may actually take this as a supplement. We know that it may cause drowsiness, but it also regulates the circadian rhythms and may have an impact on mood. melatonin will also impact the secretion of GnRH, and that is a hypothalamic release factor overall. Now, the parathyroid glands, these are small structures on the back aspect of the thyroid gland. They're anywhere between 2 and 6. 4 is the usual number. They contain chief cells and oxyphil cells. The chief cells will be making parathyroid hormone, and parathyroid hormone is another hormone involved in the regulation of blood levels of calcium. And what parathyroid hormone will do, it will increase levels of blood calcium. So it's going to increase the activity of osteoclasts. We're going to also see a decrease in the loss of calcium in the urine, and also it's going to activate calcitriol, and this is the active form of vitamin D. Now, as we get older, obviously there are going to be changes in the endocrine system, and primarily we see a decrease in the release and production of hormones. This overall reduces the efficiency of the endocrine system, and there will be lower levels of normal hormones. Probably what we see are going to be lower levels of growth hormone and sex hormones. Because of the reduced levels of growth hormone, we'll actually see a loss of body weight and mass in the elderly individual.